Yes.
Okay.
Okay. Hello, good morning. My name is Sarah. I'm going to be your nurse practitioner for today. Tell me a little bit about what's going on with you.
Hi, I'm Mark. I'm 28 years old, and I'm here because I'm having some congestion and a rash that comes and goes, and some tightness in my chest.
And tightness. Okay, well, let's go through each of those symptoms individually and we'll try to get to the bottom of this. So is this the first time this has ever occurred?
That I can remember right now, yes. Actually, when I was little, I was told I had asthma, but that was a long time ago. I haven't had any problems since.
Okay. Okay, and have you ever sought care for these symptoms as an adult?
No.
No, okay. Have you been coughing?
Occasionally.
Do you cough anything up?
No, it's a dry cough.
Dry cough, okay. Tell me a little bit about the congestion. When you feel it, is it in your sinuses or your chest?
Yeah. It's all up in my nose. It's very hard to breathe sometimes. It's been now almost a month. It kind of started happening when I started my new job at the vet. So I take care of animals.
Okay.
So yeah, it's just been more congested since then for some reason.
Okay. And with that congestion, are you having any red eyes, itchiness around the eyes or face, anything like that?
A little bit. I do get a rash that happens in my arms and my chest. I try to take some Benadryl and then it kind of goes away. So
Okay.
I don't have it right now, but
Okay.
yeah.
Okay. Let's see. So rash comes and goes, and the tightness in your chest. Can you describe that to me? Does it feel like pain, or does it feel like it's more in the lungs or the heart?
No, yeah, it's definitely my lungs. It does not hurt. It's not chest pain. I noticed that again after work, I have more difficulty breathing. A little bit, it just feels tighter. Like it's hard to get air in.
Okay.
There may be a little wheeze that I sort of feel, but I notice it more when I'm trying to climb up the stairs to my apartment.
Okay.
Yeah.
Okay. And how about at night? Are you having more difficulties breathing at night, or is it just kind of all the time that you're having this difficulty breathing?
It's later in the afternoon and at night. I say that I'm coughing more at night.
Okay. Okay. Any trouble swallowing?
No.
Okay. Have you noticed any fevers or taken your temperature?
No, I haven't had any fevers.
Okay. And did you say you had a runny nose as well?
Yeah, I do. It's been now a month on and off.
Okay. I need, what color is the drainage?
It's clear.
Clear. Okay. Have you taken anything for any of the symptoms to make them better other than the Benadryl for the rash? Does anything make?
No, just the Benadryl. It helps a little bit, but it just comes back.
Okay. And anything other than being at the pet store, or I'm sorry, the vet clinic, anything make it worse?
No, that's pretty much it.
Okay. Okay. So do you have any allergies to medications, food, environmental allergies that you've been diagnosed with? No? Okay. Other than the Benadryl that you're taking as needed, are you on any other medications?
No.
Okay. Let's talk a little bit about your past medical history. You said that when you were a kid, you were diagnosed with asthma, but you haven't had it since. Do you have any other hospitalizations, chronic medical diseases that or conditions that you've been diagnosed with?
No, I'm pretty healthy. I kind of remember, the asthma when I was little, but it wasn't a big deal. I think I had an inhaler, but that was a long, long time ago.
Okay. Are you up to date on your immunizations, or have you had any recently?
I haven't had any recently, but when I went to college, I was up to date.
Okay. Let's see. And do you know when your last physical was?
For this job, actually, but a couple months ago.
Okay, and everything was normal.
Yeah.
Okay. Let's see. Have you recently noticed any weight or appetite changes?
No.
No. Okay. And how are you sleeping?
Okay. When I can breathe, and lately I'm having to, when the congestion is a little harder to fall asleep, but then I do okay.
Okay. Let me see. Tell me about your family health. How are your parents? Are they alive and well? Do they have any chronic diseases? Have they ever been diagnosed with anything?
They're pretty healthy. My mom has allergies. She gets allergies and she has asthma, but uh, my dad has high blood pressure, but everybody else is pretty good.
Okay. And then tell me a little bit about your social history. Are you a cigarette smoker?
No, I don't smoke.
Do you drink alcohol?
Occasionally.
Okay. And then how about any recreational drugs
No, I don't.
No? Okay. And how about exercise? Do you exercise at all?
I used to, but I don't have time now that I have this new job.
Okay. Let me see. Tell me about your relationships. Are you single? Are you married?
I'm single right now.
Single. Okay. And do you live at home with your parents, or do you live on your
No,
own?
I'm on my own in my apartment.
Okay. Okay. And any recent travel?
Nope.
Okay. So I'm just going to go through a quick review of conditions that you might be experiencing. You can just say no or yes to anything that I say, okay? Are you experiencing any night sweats or chills?
No.
Okay. Any sinus pressure or sneezing?
Just a congestion, occasional sneezing.
Okay. Chest pain, palpitations, or swelling in your legs?
No.
Any acid reflux, nausea, vomiting, constipation, or diarrhea?
No.
Okay. Any burning, urgency, or frequency when you urinate?
Nope.
Any balance issues?
Nope.
And any bruising?
Nope.
Okay. So that concludes my history taking. Oh, I don't know if I asked how old you were. How old are you?
28.
28. Okay. Thank you. So now we're going to get into the physical examination. And do you have vital signs?
Yes. Temperature of 98.6, blood pressure 120/75, saturation 95%, heart rate is 65, respiratory rate is 12.
Okay. Okay. So let's see. I guess is a good time to do differentials, which I would say would be an upper respiratory infection, asthma, allergies, sinusitis, postnasal drip, bronchitis. Yeah, that's probably it for now. Let's get into the actual physical exam. I would like to know about your general survey, if there's any distress or how the patient is constitutionally.
I'm comfortable. No apparent distress. Well-groomed and well-appearing healthy male.
Perfect. Let's talk about the skin.
Well, this is a Caucasian male. It's pretty much pink mucosa, no cyanosis, and the nail beds. Yeah.
Okay. And no rash at this time?
No rash at this time.
Okay.
No lesions. Mm-hmm.
Okay. And then let's do the HEENT. Let's start with, head, I suppose.
Yeah, so I'll just give you it. So there is So there's mild injection in the conjunctiva, but there is no drainage. There is some clear discharge in the nose, so you can appreciate a slightly hyperemic turbinates. The throat is clear. There are no lesions. Tonsils are +1. No exudates. No erythema. The ears are also clear. The TMs are intact with positive light reflex and visible bony prominences. There's no redness, and there are no oral lesions. And the neck is supple and no masses.
Okay. Neck supple. Okay. So we got that all done. So, and you said neck is supple. How about lungs?
The lungs have a very mild expiratory wheeze. Otherwise clear, moving air fairly well.
Okay, moving air. Let's move on to heart.
Normal sinus rhythm, no murmurs.
Okay. Let's do an abdominal exam.
Abdomen is soft, no palpable masses, positive bowel sounds.
Okay, positive bowel sounds. How about neuro? Gait, reflexes, any tremors?
All reflexes are intact, normal. Good balance. You observed the gait was also normal.
Okay.
And yeah, all the cranial nerves are grossly intact.
Perfect. And then finally, lower extremities, pulses, any edema, that sort of thing.
Equal pulses or +2 in all extremities, and no edema.
Okay. Okay, so from here, the diagnostic tests I would like to do would be a peak flow test and also allergy testing. Because the diagnosis that I think this is because you just started working in a vet clinic near animals and you once had asthma when you were a kid. I'm thinking this is allergy related asthma. So my treatment plan would be to order an albuterol inhaler for PRN use, and also an inhaled corticosteroid and Singulair, both to use daily. My education would be to teach about inhaler use and the need to swish and spit with a solution to prevent yeast after every use. I would also educate about asthma, saying that it can be a chronic disease but is controllable. I would teach about triggers, including smoke, pollen, and dust mites. And then as for a follow-up, I would return to care in 2 weeks to reevaluate breathing, peak flow, and medication usage to see if these are the right medications for you.
Great.
How do you feel about that? Good?
So does that mean that I can keep working there or?
I think, yes. I think that you can keep working there unless it's extraordinarily intolerable, but we can reevaluate that after we make sure your medications are working.
Awesome.
Okay.
Thank you.
Thank you so much. I really appreciate you coming in.
All right.